Hi, I'm Heather, and I'm the nurse educator here at San Joaquin Valley Rehabilitation Hospital. And did you know that May is Stroke Awareness Month? I just want to take a few minutes to give you some pointers about strokes. And so I would like to start off by talking about what a stroke is. So a stroke is an emergency, and what happens in the brain is there's a blood vessel that either gets a blockage or it ruptures. And so when that happens, the blood flow to the brain is disrupted, and we can have ischemia or tissue death. And so it's very similar to like a heart attack in the heart. You're having a brain attack in the brain. So it's a medical emergency, and you want to get it checked out right away. So every 40 seconds in the United States, someone has a stroke. And so it's really important for all of us to be aware of the signs and symptoms of stroke so that we can identify that when it occurs. So there's a really easy acronym to remember. It's called FAST. And so F is for facial drooping. So if you're looking at somebody and their eye is drooping a little bit, or you ask them to smile and their mouth is uneven, there's a chance that they might be having a stroke. There's also A for arm weakness. So if you notice that they're not able to move one arm, or often we'll have them hold their arms up like this, and you'll see one kind of start to drift off so that they're not able to hold it up all the way. That would be a sign of stroke. And then also S is speech difficulty. So if they're not able to speak, or if you ask them to say a simple sentence back to you and you notice slurred speech or difficulty with some words, that could be a sign. And then last we have T, which is time. So time is of the essence. We say time is brain. So the faster we can get them diagnosed and treated, the better chance they have at recovery. 80% of strokes are preventable. So I want to take a moment to talk about some risk factors that we can all address, and even in small ways make a big difference in how we, in preventing our risk for stroke. So we'll take a look at our infographic here. The major ones would be high blood pressure and high cholesterol. So those are things that you're going to want to work with your doctor on and make sure that you are well controlled, and that will significantly reduce your risk for having a stroke. Also, if you're diabetic, it's important to make sure that your blood sugars are well controlled, because that will also reduce your risk. If you smoke, try to quit. And if you don't smoke, don't start. And then also, e-cigarettes are also a risk factor. So try to reduce your use of e-cigarettes or don't start those. And then also, we all need to be working to maintain a healthy weight. And we can do that by increasing our activity and improving our diet. So the Surgeon General actually recommends 2 hours and 30 minutes of a week of activity. So that's about 30 minutes of 5 days a week. And then also, if you can look at your diet and make small changes, like lowering your sodium intake or decreasing your fats, and then increasing your fruit and vegetable intake, that can make a significant difference in your risk factors. So, all right, well, I hope this was helpful, and I hope that all of us can do our part to help prevent stroke and increase awareness. And thank you.